A reliance on government to fund the delivery of social health care in the Virgin Islands is not sustainable, says Chairman of the BVI Health Services Authority, John Klein, who has described the situation as a train wreck waiting to happen. Addressing the issue of the rising cost of health care worldwide on JTV's talk show Speak Your Mind on May 5th, John Klein said the proposed national health insurance system seeks to address the issue of financing health care.
The National Health Insurance Scheme is one of the ways that the government of the British Virgin Islands has proposed to provide health care for all of its citizens, and which we call access, and provide quality health care for all of its citizens, which we call quality. So if I had to put in a nutshell what it is we're trying to fix, we're trying to fix in the BVI healthcare delivery that is a quality healthcare that give our people access at a sustainable cost.
The chairman of the BVI Health Services Authority insisted that the national health insurance system is necessary to help fund the high cost of health care. Klein further outlined that the value of providing health care for underinsured and uninsured persons through the BVI Health Services Authority is significant. He said for one given month, close to $750,000 worth of healthcare services was provided, but the Health Services Authority received nothing in return.
The cost of the service delivery to those people who are uninsured or underinsured or deemed what we used to call exempt, for the month of, what is this? I think for the month of February it was. You know how much that was, Sam? From a hospital standpoint, about $660,000. Somewhere in that neighborhood. That's what it costs us to deliver health care to those people. On the return of that to the hospital, how much? Zero. $0 comes back after almost giving the service out of $750,000. Can I continue to go to the government and the minister and say, pay this, or present myself to People's Hospital, check in for care and check out, and don't pay a dime, and expect to have good doctors, good nurses, expanded services that we can deliver? Can we do that? No, we can't. We need to look at this thing and give the government an opportunity to present their case for the national health insurance. I'm not saying what they've presented is all perfect, but to start and to present is a beginning of stopping this train wreck, because this is a train wreck waiting to happen if we don't do something about it.
In January this year, the National Health Insurance Steering Committee embarked on an educational campaign titled National Health Insurance, Your Security for a Lifetime, in preparation for an August 2013 launch. However, some sections of the community voiced concerns about the proposed National Health Insurance Plan, which requires all employees to pay 3.75% of their salary and employers to pay 3.75% of their employees' salaries. Health Minister Ronnie Skelton, speaking on May 7th at a community meeting in Virgin Gorda, said the process was stopped to look at the concerns by the public. He said currently government contributes in excess of $30 million to fund health care, and even with the national health insurance in place, government would still be required to contribute to the cost of health care. Minister Skelton said a government has a responsibility to provide affordable health care to its people.
There are all kinds of complications that people have, that they need medical care. And a country as BVI, we cannot just sit back and don't give access to care by those who can't afford it. So on a daily basis and a weekly basis, the Ministry of Health, we spend $20, $30, $40, hundreds of thousands of dollars trying to get people the care they need. We need a comprehensive system to fund and finance our healthcare system. It makes no sense we continue to be selfish and individual about it. it will come home to roost. You will lose your job one of these days. You will have no insurance for you and your family. And insurance companies, regardless of what they say, they're interested in their bottom line. A country, a government has a responsibility to look after all its people and give them affordable health care at international standards. And that's what we're trying to achieve. I don't want to be seen as being anti-insurance companies because they have a role to play. Insurance companies have a role to play. But I continue to listen to people, even here in Virgin Gorda, who have retired, and because they get some conditions, some medical condition, they're dropped from insurance companies. We cannot continue to allow this to happen. As a people and a government, we are responsible for looking after each other.
The National Health Insurance System proposes an affordable healthcare system for all legal residents in the BVI. It is expected to cover primary health care and modern diagnostic services, medicine, inpatient care, surgeries, dental, and eye care.